great.
I agree, you look good.
I think you're really,
Right,
Thank you.
yeah. Hey guys, it's Dr. Emer, and we're doing one of my favorite treatments. I want you guys to know it's more popularized now to do hand filler. But 10 years ago when I started doing this, you're gonna feel a little pinch and a weird movement. It wasn't as popular. We were doing what we call the matzo ball technique at that time, where we would fill up a bunch of filler and then just smash and burn. We would push it all the way around the hand. Now we're using a cannula. We're literally going around veins and tendons softly with no bruising, and we're injecting the filler. I even combine two different fillers, one that addresses more of the volume, the other that addresses more of the wrinkles. So you get a softer look and collagen production long term. So what we're doing right now is is this combined or are we doing it separately?
They're separate.
Okay, this is Radiesse, our calcium-based filler. It's one of two FDA-approved fillers for hands. The other one that's approved is Wrestle Lift, which is a hyaluronic acid. The reason I like the Radiesse, I'm gonna do a little bit more there. Hold on. Squeeze your hand lightly for me, just a little, slightly. The reason I like the Radiesse, you guys, is it blends. It has an opacity to it, so it blends really naturally. You can see already the tendons being filled. Now relax your hand, and it blends really well, but also builds collagen over time. So it's one of the few filler where you're actually going to get a long-term improvement in this area. But you want to do little baby threads, not like the matzo ball technique that we used to do in the past. And then we're going to add in on top, in a different layer, a little bit of Bellatero. And Bellateros are what we call finessing filler or fine line filler. That filler can be used for very subtle areas, but it works great for crepiness on the hands. And by doing it in this way, we're going to see really no issues. I will tell you, you do get a little swollen for a couple days. It almost looks like your hands have a little bit of a mitt on them. But then it looks great as the next couple weeks go on. And so we're just sort of blending. Okay, that should be good there. Squeeze your hand together. Now give me one of the Bellateros, please.
Do you want needle or hand?
Yeah, a needle. And now everything is numb. We've blended. We're doing a little bit of rubbing. Now relax. We're going to fine fill now lightly with our finer filler closer towards the knuckles. You really shouldn't feel much. Little blebs, 0.1s, all across around the knuckle area where we really don't put a lot of the Radiesse, because this is going to give a little softer look where the crepiness is, where crepiness develops. Squeeze again for me, your hand, beautiful. We're just going to soften right there. Now relax again. We're going to go into those in-between spaces. Squeeze again for me. Perfect. We're just going to isolate those. Relax a second. Little tendon back here we're going to cover up a little bit as well. Perfect. A little bit over here. And we do the tenting technique where we just put a little bit of filler right into that plane. Now go ahead and squeeze again. Beautiful. And so now, take a look at the tendons and veins, almost all gone. Looks great. Relax your hand for a second. Perfect. So obviously there's some swelling. So sort of let that sit a minute. Is this the other half? This is what's left of you. So she's not going to feel
I
it.
don't feel anything.
Yeah.
She doesn't feel it all, which is great.
Yeah.
Walking part.
Told you this is easy.
Yeah.
So here I'm doing little blebs across the dorsal part of the hand with the Bellatero, which is going to give us a little bit more of a plumping effect. Good. Go ahead and hold that. Squeeze again. And we're just going to lightly massage. And then within the next 2 weeks, this will blend in perfectly, which is going to look great right away. So now what I'm going to do is take an ice pack for me. Ice pack. We're going to put that right on top. We'll let her rest a second. Now I'm going to take her other hand, although you probably won't need it. I'm going to go like that, and you guys can see. I'm going to show you the difference. Take a look at that hand versus that hand. See the difference? So we filled in all those spaces. Yeah, there's a little bit of lumpiness now, but that's going to all settle. It's normal, it's just swelling. So everything looks great. So that's, excuse me, that's hand filler. All right, we're live.